I'm going to welcome some people to come and sit in these comfy chairs. I'll just call you by name. Would you please welcome Sally North, the Acting WorkSafe Commissioner. Professor Dino Pisaniello, who we met earlier today. Dino, thank you very much. Tracey, Bence, from the Australian Institute of Occupational Hygienists. Dr. Matt Govorko, from the Cancer Council, and Pierina, Otness. Thank you very much. Now, this is going to take us to our sort of natural conclusion. And you look at what's on the screen, lung carcinogens in the workplace. And we'll be asking ourselves, where does the discussion begin? And thank you very much, Ben. My next question was, where are the mics? Thank you. Really appreciate it. So what I would like to do is just begin by asking all of you what that sentence means to you. And then after which we've had a bit of a yarn about it, I really do hope that there's an opportunity for those of you in the audience to put some questions. It might be to the panel broadly, or it might be to an individual, but do take that opportunity. I think we'll be doing this until about 3:10. I think that's our plan. So let me begin with someone with whom we've not spoken to today, Sally North, the Acting WorkSafe Commissioner. Sally, what's important about this subject? What do we need to know? Keep talking and we'll know if it's on.
Testing. Oh, excellent. Thank you. All right, lung carcinogens in the workplace. I think you can't really ask for more of a segue to that topic than the presentation we just had. So to me, what it means is that we do need to be proactive in the field of worker health. The issue and challenge that we often have is that workplace health issues often take a while to actually eventuate in a health condition, and it really makes it hard to communicate those risks and to understand those risks at the time. So to me, it's about being proactive. It's about remembering where we've come and some of the really significant events that have occurred right here in this state that have really been quite disastrous if we look at Whitnum as an example, and working towards making sure something like that doesn't happen in the future.
Dino, an observation from you. I think one of the significant parts of this conversation today has been a growing understanding in a post-COVID world about what those internal spaces primarily are like and how we'll monitor them and the extent to which we will be aware of the air quality in those spaces. What's your broad observation about that?
Well, I suppose from my point of view, and this is a quote from somebody else, everyone has to breathe. And so what we breathe is going to be determining our health. It just goes to show you this, the lungs are diverse in their sort of function, and things can go wrong in different ways. We just have to look at, for example, the difference between silica-related disease and some of the other carcinogens that can cause lung cancer. It's really quite a diverse topic. So I think we have a lot to learn, but it does go to show you that, and I've got to tell you that my father-in-law died of lung cancer. I think it does go to show you that it does affect a lot of people. Cancer does affect a lot of people, and it's an area that we continue to work on.
Please, Trace, I think you know the nature of the question, and we heard from you earlier, really taking us on a tour of our past and also the challenges that we face ahead.
Well, the challenges are definitely there. The lung carcinogens stand up against a lot of hazards at work. And so I'm terribly empathetic for all of you in the audience who are communicating risk, prioritising actions, influencing decision makers to take action on a microscopic hazard that may not materialise as harm for 10 or 20 years. But it does give you the opportunity to make incremental change. Slow, maybe steady, maybe 2 steps forward and 1 step backwards. But our job as work health and safety professionals is to make visible what is invisible and to contextualise what the risk might be against all the other risks, including collision, truck rollover, COVID, all these other things that are potentially taking the attention. but we don't have a lot of years with lung carcinogens. It's maybe not even decades. So the action needs to be taken now.
Just on that, and from what you said earlier, and I sense when you speak too, this great determination, but also this great sense of urgency, because perhaps the opportunity has been presented to us in the past, and for whatever reason, we have chosen, we have chosen not to respond as quickly as we need to.
So the two things that play on my mind with this conversation are accelerated silicosis and the gross exposures. So gross exposures are out there in every sector, and whichever way you cut the numbers, if you're going to measure the air because you want people to breathe freely, then you have to look at those numbers and take action when you see the exceedances of exposures, or you can predict the exceedance of exposure limits or health-based limits based on statistical analysis. So if you have that little toolkit in your hand, if you're a statistician, if you're an air monitor, or if you're a decision maker with regards to controls, then yeah, I'm pretty urgent to talk to you.
Yeah, I'm sure. Matt?
So in terms of lung carcinogens for us, for our program for Cancer Council, what we are focusing on, we've got 4 priority occupational carcinogens. So asbestos, which is relatively well known compared to some of the other carcinogens. It's relatively well resourced. We're focusing on diesel engine exhaust, which I touched on during my presentation. That's one of those ones where the awareness isn't necessarily there, such as asbestos. So we're looking for really to drive up awareness of these issues. The other 2 being silica dust and welding fumes. So the other challenges with diesel engine exhaust and welding fume exposure is they don't have those tangible or might say immediate health impacts, say like accelerated silicosis that came on really rapidly. But whereas lung cancer has that lag time, that 10, 20, 30, sometimes 40 years, and that can sometimes mean it takes a back seat to the other immediate issues. So it's really about us increasing awareness, education and training so that it doesn't get forgotten. And those other carcinogens do get covered. So.
Pierina?
I guess bringing the public health element into play, lung cancer is one of the most common cancers that can occur. And, being conscious of those lung carcinogens in the workplace, but also educating the workforce around what they do at home, making sure that if they're renovating at home, that they're making any dust at home, that they're doing any potential exposure to asbestos or other hazardous materials, that they remember the workplace safety controls and bring them into the home as well. Talk to your kids about vaping, talk to your kids about smoking, remind them how important their lungs are to their long-term health, and make sure they understand this is a really important organ and it needs to last you a very long time and you've got to look after it.
Yeah. Could I just ask a question about vaping, because in a way that is a very contemporary extension of the tobacco industry as far as I'm concerned. We don't know an enormous amount yet about the impacts of vaping, but I think there are probably very strong suspicions that we actually do understand. Is that the challenge? It seems to me, the conversations today have been about asbestos and about silica and about diesel particulates, and then now we're talking about things like vaping. Do we not have a capacity to understand that there's a commonality about all those things and the impact they're having on our lives?
Yeah, absolutely. And the tricky thing is people are waiting to see if, vaping is causing lung cancer and things like that, and waiting to count the cases, but we can't approach it from that angle. We've got to be really proactive. We've got to use the precautionary principle. We know that vaping is, if you are vaping, you're at increased likelihood of then jumping across to smoking cigarettes, which is a known carcinogen for sure, or tobacco smoke. So we've got to be really proactive in implementing strong regulations restricting use of vapes in workplaces, for sure.
I agree with all those things, and I would like to add as well, vaping is one of those very unregulated spaces, and so what's in the vape, and it is not always even what it says it is. It's not. You can have no trust in what that material is that you're vaping, or your children are, and there are studies, there are definite harms associated with vaping. So we link some guidance on our website about our recommended approach to vaping in the workplace. We recommend an approach, that you take an approach a bit like you take to smoking management to make sure that people at your workplace aren't exposed to, secondhand vaping as well, because we do think that you need to take a precautionary approach. And we have linked on there one of the papers that show really very serious lung damage that can happen. And look, the extent of that damage may be dependent upon the nature of that vape, but that's an unknown. So, big note of caution there. Thank you.
We saw some images earlier of fellas working with asbestos at Whitnum without shirts and just wearing their shorts, and that was a generation ago, perhaps. Now we see the clean-up and everyone is wearing PPE, and I guess we ask ourselves how effectively we are learning these messages. Dino, as someone who's been involved in this for a very long time, I'm interested to know 5 years from now, 10 years from now, how confident are you that our response to these things will evolve quickly enough for us to be able to deal with the very real threats posed by them?
Well, I'm not that confident, actually. I think people need to sort of adapt to the circumstances. With vaping, for example, it reminds me of big tobacco and what does the industry try to sell and who's vulnerable and so on. So putting stuff in your mouth and breathing it in obviously has its consequences. So that's a social kind of consideration. But I do think that as with the experience of COVID, people are more aware of the opportunities to protect their lungs with masks and so on. I think the understanding of respirators has increased quite dramatically, and they do have stock of those things, whereas in the past you couldn't buy a respirator unless you went to a hardware store or something like that. These days people know what the options are, and I think it's really a case of reinforcing what we encourage, which is good health practice, and certainly smoking anything really is not a good idea.
Yeah. Can I throw that question out more broadly, just where you think we might be 5 years from now, or what you think we have to do to feel that we are better educated and better understanding of what those risks might be? Who'd like to do a bit of crystal ball gazing, please, Pierina?
I talked about, in my talk about the momentum of COVID, I feel that already some of that momentum is getting lost. So this is not surprising to me. Indoor air quality in my career has already had its ups and downs in terms of being the popular thing to focus on. And asbestos, it's something that has kept me busy my whole career, whether it be occupational or environmental settings. ASEA, Australian Safety and Eradication Agency, have done studies where they've looked at 30-year-old and under who don't know what asbestos is, don't realise it's their home. So I fear we are terrible at remembering the past and really very readily repeat the mistakes now because, yes, we all know, everyone in this room knows, but the broader community doesn't know. Our under 30-year-olds don't know. They aren't taking the precautions. They're 30 years old, they're bulletproof. It's not going to happen to them. So I think we have a real challenge, a communication challenge, in making sure that this stays at the forefront of policy, at the forefront of people's actions. And that's a role that we all share in this room and beyond, in listening online. And I feel that we're going to be struggling to get that message out, at least for the rest of my career.
Yeah. Tracey, just on that, the challenges in the future, we hope that 15 years from now we're not still warning people about the dangers of silica, but might we be?
What I think we will regret in 15 years' time is that we didn't invest in science. I think we'll be sorry that we didn't invest in regulation. I think we might be sorry that we didn't demystify the airborne hazard and make it palatable, understandable and real. And to do that you need scientists, you need work health and safety professionals, you need research, you need hard data, and you need all matters of policy and whole of government approach. So I don't work for the government, I can say that. But yeah, I'd hate to be in a position where we're sorry that we didn't have enough regulators or inspectors, or that we didn't get STEM into schools so that people can understand the science that can protect them.
Matt, just on the subject of where we might be 15 years from now, and at the same time we can argue that our public health attitudes towards smoking in this country has been outstandingly successful, perhaps only to be replaced by a new kind of technology that might create a whole range of new issues for us as well.
Right, that's one of the main concerns, like Pierina said, is you don't want to undo the gains of the past. So with asbestos, you're seeing people below 30, the awareness, the knowledge isn't there, you've got to retrain them, you've got to keep on top of the game with that awareness and education. And then the issue, and that goes to tobacco, where there's been such promising gains the last 30, 40 years. We've seen constant declines in smoking rates. However, for the first time in 30 to 40 years, we're starting to see a reversal of that trend because of vaping, where you start seeing it's slowly starting to uptick. And one of the key issues is that vaping is now normalising that behaviour again. It's normalising tobacco smoking, and the regulations just haven't kept up with that yet. So there's a lot of unknowns, and yeah, something we've definitely got to keep on top of. Yeah.
Could we also talk about the good of the pandemic? Well, there wasn't much, but I think all of you at different times have sort of hinted that there were certain things that we learned. And, I wouldn't say that you could walk out there and there'd be a conversation about better filters going on, but there might be in a way there wasn't before. Can I ask all of you if you think there was a legacy from the COVID experience that may prove useful?
I'll put a couple of pointers for starters. I think one of the things that has been useful for awareness is that people have heard of a few professions they haven't heard of before, including occupational hygiene. I think it's good to know that people have heard of what an occupational hygienist is, so they can seek one out if they need one. I think that's a benefit. I also think there's a little bit more information out there about respiratory protective equipment, about the different types of that, and about fit testing, which I don't know that many people had actually heard of previously. I mean, obviously outside of the profession itself. Thanks.
Yeah.
I'm going to jump on that quickly and just say, all of a sudden everyone knows what epidemiologists are as well. So all of a sudden they shot to stardom, and that was awesome to see. I'm definitely biased though.
We talk about healthy buildings and not sick buildings.
Not sick
Do we
buildings.
need to understand that in a more sophisticated way? Because I got a grasp of what it is, but I can just hear my former colleagues in the media using this to great advantage to sell a kind of story, but we don't, to your point, Tracey, we need to understand what underpins all these terms and the science that underpins them.
Well, could I just say that one of the legacies of COVID, which is still here, of course, is that everyone's talking about it. Whereas in the past, you wouldn't talk necessarily about the connection with the school classroom or the connection with the workplace or transportation and so on. So everyone's sort of a lot more aware of the interplay here. So just having that conversation and having people who are willing to advocate for certain things as part of that conversation, I think is going to be very helpful.
What about, might be a difficult one for some people to answer, what about regulation? What about regulation? Let's say there's a regulation 6 months from now that says there will be no more engineered stone in Australian kitchens. There will be no more ability to buy vapes in shops. Now, I know for some people in this room that is what you would very much like to hear. What is the role of government here in not just warning us of dangers, the point at which government says, as in a case like Whitnum, eventually you've all got to clear out. We just have to make decisions. How do you perceive the role of government, even those of you who work in government?
Can I just say that in public health, the best evidence of public health is where people are not aware of it, that there are institutional and structural systems in place where people just take it for granted. So, to have a visible public health presence and so on is actually not a good thing. I think we just need to build in the structures and systems so that public health becomes part of everyday life.
I mean, you expressed the public health dream, didn't you? Unfortunately, there's other influences on government. So as much as, we want to sell the public health dream in this room and we're all the converted here, equally you'll have small businesses who run vape shops who will lobby government. There are lobbyists that present the counter argument. And so as a public health professional, because while I work for government, really my role is the protection of public health and administration of the Public Health Act. So, my advice to government is listen to us, listen to the science in particular. I think, Tracey makes a very good point. Listen to the science, because one of the reasons why the vape messaging gets traction is because you give them part of the message. Oh, it's better than smoking. Better than smoking doesn't equal good. Yeah. But we'll just leave out that part that it actually still causes harm. So, the lobbyists to government do kind of take the message away, and I think, as Tracey said, science is the answer to that, and we need to have good research and good science that informs government policy.
Absolutely agree that the research, really is important to underpin government decisions, but just also you asked kind of how that would look, and I think the answer there is we kind of have a model how that would look because of the ban of asbestos-containing materials now a few decades ago. So that is an example where the government, after, a long journey, I guess, in recognising all of those hazards of asbestos, and again, a lot of, industry inputs into that decision, did make a decision that we would not anymore have new asbestos-containing materials. And they put a process around that. It was a phased-in process, and there's management requirements around the in-situ product that we still have and that we're still going to be managing for decades to come. So that is the model. If the government decides, having reviewed the data, the risks and the benefits, that is the way that they're going to go.
Most of the people in this room work inside buildings. When we look at the buildings that we spend much of our time in now and into the future, will we be vastly more aware of the air we breathe inside those buildings compared to others? And Dino, when you were speaking earlier, there was a question about, obviously, you can't retrofit everything and there are old buildings that we're working in, but do we have reason to believe that our workplaces, that the air will be purer and sweeter over time?
Yeah, it's a good question. A healthy building, not just the air, I think it's the environment overall. I think the challenge is to use technology, to use big data, to use what we know about mathematical models to predict in advance what might happen and then validate what is actually happening with real-time information that people can refer to. So I was talking to a developer about a year or two ago about what they would like to see, what could they expect in a Class A building, a building for tenants of, like government and so on. What would they like to see? And it seems to me that what they'd like to see and what they'd like to have in their building is some displays which show concentrations of particular contaminants, that there is a signage that reinforces the idea about this is a building which has been designed for human occupancy and so on. So I think the challenge is for people to realise the value add of healthy buildings, and so the science will follow that, and hopefully, we'll have an environment where we're basically protected from the outside, inside the building, and that's what people would hope anyway, that it does represent a form of risk mitigation. As we know, our house is our castle, it's our refuge and so on, and that's what it should be, and we can design it that way.
Will we get to a point where, there's an ongoing discussion in cities all around the world about people who went home during COVID and didn't want to come back to the workplace? Is it sort of incumbent on those workplaces now to draw people back by saying this is the new safe space for you to be? Or will more people, do you think, want to stay at home where they have the air purifier and the Glen 20 and feel slightly reassured that what they have is the safest version for them?
Everyone will feel more comfortable where it's a voluntary risk. as Pierina said, you know, we accept the things that we can control as being better, even though they may not be. I think the challenge for building owners and managers now is to get people back into the workplace, but they will only do that if they can demonstrate that the building does represent a safe working environment. And I think that is where we're going with all these schemes that exist for major buildings. Certainly for older buildings, that's going to be a challenge, but that's not to say you can't introduce some change which is going to create a more positive environment than what there has been in the past.
Dino, thank you for that. A question from a member of our audience, and it sort of relates, I guess, to the role of government or the role of regulators. How can we influence leadership teams to take the necessary steps to invest in exposure controls without a push from a regulator in regards to notices, etc.? So how do you convince those who do have the ability to make these decisions to do the things that they really have to do to keep people safe?
And, you know, isn't that the million-dollar question? So I think, though, that the modernised regulations, the Work Health and Safety Act in WA and the officers' duties are a really great place to start. I think, you know, there is information out there about due diligence, and we heard a little bit about that earlier. And if that is well communicated and the risks associated with due diligence are well communicated, and of course the specific compliance issues, because compliance is one of the officers' duties, is to actually identify whether they're complying or not, and to have systems in place to verify that compliance. Educating around all those things is a great first step, and keeping your executive up to date with case studies. If you can get onto some of those information sources where you get case studies about things that have happened. I know, you know, we don't want to have to wait for things to happen, but at the same time, we've got the whole country using harmonised legislation, so there are learnings across the country that can be applied. So I would start with that piece of education and making sure that you're very transparent around both those duties and about the compliance challenges. And of course the hierarchy of control, which is also referenced in the legislation.
Tracey, do you have an opinion on how you manage to convince leadership teams or decision makers to do that which is required?
Yes, and it is just my opinion, but I have learned that risk is the loss of something that's important to me. So personalising messages for leadership around what is at stake can sometimes lead people in places where they wouldn't willingly have gone. But if they can envisage what it looks like for a victim of a lung carcinogen, if they can remember what it was like when they actually worked themselves on the tools, or when they had the exposures to diesel exhaust or unwelcome dust or excessive heat, then I believe that you can move them a lot closer to actually saying, this is something that I want to invest in, this is something that I will make policy, and this is actually good business. Because I don't want to be looking over my shoulder thinking, 10 years ago, that was me. That was me with a lungful. So yeah, personalisation of the message, I think, is a good companion, along with regulation and sound science.
Okay. I'd like to go to a couple of specific questions that have been asked. In WA legislation, are we required to fit test our workers for the use of disposable P2 face masks? If so, how is the fit test conducted? And they give the example of concrete cutting. Who would like to grab that? Sally.
So fit testing should be conducted, and inspectors do look at that, and we do have guidance on the WorkSafe website. So if you do a little bit of a Google for fit testing and WorkSafe WA, you should be able to find that guidance. In terms of how to, we do provide, while it's not, you know, some Australian standards are called up as mandatory, others are there as another form of guidance. So there is an Australian standard that's available, and it really goes into great detail around the suitable methodologies for fit testing. And there are accreditation, there's accreditation available for fit testers as well. So would encourage you to look for an accredited provider of that. And of course, in that industry specifically, absolutely worthwhile, because respirators don't work if they don't fit. And we see so many people in beards and stubble and so forth that are wearing a respirator that ought to be close fitting. And inspectors, not that, as we said, we can't rely on an inspector turning up when you need one, but they do certainly issue notices where they're finding non-compliant use of respirators.
Should we be lowering the welding fume WES limit, or should we be reducing WES limits of the common metals found in the welding process?
I can take that one. Because the AIOH has a position on this. In 22, we published a position paper on welding fume and the constituents, the other metals. And our position is that it should be lowered, and there should be a 1 milligram per metre cubed WES for fume in its totality, combined with the individual constituent metals, some of which in their own right are carcinogens. WESs for those are under review, and that is welcome.
Yeah, and I just echo Tracey's sentiments there. Cancer Council Australia, we also have a position on that. We made a submission to Safe Work Australia's Workplace Exposure Standard Review, and we said very similar things, that there definitely should be a standard in place. It should be 1 milligram per cubic metre, and also at the same time measuring the other constituents which can be carcinogenic. So.
This might be a question that Josh and Sam obviously have great expertise. This came from us a little bit earlier. Can you handle asbestos, or is it dangerous when disturbed, or is it only dangerous if cut, releasing the fibres? And the asking of that question goes to a point that was made earlier today, and I think that question was, have we forgotten about asbestos? It's a very good question to be asked, but the fact the public doesn't know the answer to it reminds us that we have to keep providing the answer, I think, Pierina.
Yeah, so I'll field it for you guys if you like. There's a lot of discussion around bonded versus friable asbestos. I think you have to look at the risks associated with the work that you're doing and the disturbance you're going to create. If you are going to create a disturbance that produces dust, you are at risk of inhaling fibre if you're handling asbestos. So really, it's a common sense approach to that. If you're cutting, if you're sanding, if you're disturbing in a way that produces dust, then you are creating airborne dust, and within that airborne dust will be fibre as a constituent. Obviously, things like cutting with power tools creates more respirable fine fibres, but any disturbance of asbestos should be treated with absolute caution.
Yeah, we often hear of a third wave of asbestosis, and that phrase was used in the context of people renovating homes and doing such things. Do we still talk with that degree of concern as we maybe did a few years ago?
Yes, we do, because that's there's still potential for actually significant exposure when you do home renovation. So some of the activities that people do in home renovation very much reflect what was happening in the workplaces in the past. So they will cut through accidentally asbestos, they'll use an angle grinder, they'll use power tools unwittingly, and they can produce, if you look at old data that we have, they can produce up to 20 fibres per mil. So if you think of an exposure standard now in the workplace of 0.01 fibre per mil, that's many times above the occupational exposure standard, which can happen from someone doing a job at home. While we want to consider lifetime exposure risk to asbestos, we also want to make sure that we minimise our lifetime exposure by not undertaking tasks that produce dust that we inhale that has many times the occupational exposure standard concentration in it. So we need to be careful about that. Even high pressure water hosing of your roof, maybe you do that when it's wet, but that material is going to dry, and then as soon as you disturb that material, that can create dust, and that dust will have fibre in it.
On the subject of the buildings we go to work in, the old ones, the new ones, an observation here, real challenge is not new buildings, but the prevalence of older buildings and the excessive costs of modifying or reconfiguring current setups. Any advice? Do we leave those old buildings, or is there a willingness to retrofit as required?
Thanks. Well, I think it gets back to air cleaners and utilising air cleaning technology in addition to what's already there. So I'd certainly suggest that one. But I think it's a case of source path receiver. Where is the source? Where's the path? Who's vulnerable? We need to analyse that. In every building is different. Every building has its own airflow patterns and things like that. And even in the old buildings, but in the new buildings as well, you need to understand where the air is going so that you can intercept that, as someone was mentioned, and therefore reduce the risk.
Okay. Ladies and gentlemen, we've only got a couple of minutes left. What I'd like to do, starting at that end, is just ask you, is there something you would like this audience to know about that which we've been speaking today? Pierina.
I guess what I'd like the audience to know is that your work is really, really important, and sometimes you're very busy doing your work as an occupational health professional and public health professional, but your work is really important, and I think reminding yourself of why you do it and the purpose behind it is something that I want you to remember, because at the end of the day, what our job is collectively is to protect human health. And so, I think just bear that in mind when you struggle with management, when you struggle with getting workers to listen to you or members of the public listen to you. Just remember what you're there for, and hopefully that will give you the juice to keep going.
Fantastic. Matt, a quick word from you.
Oh, that's brilliant. I'm going to take it a slightly different way. I'm going to say it would be really good if you could take back the recommendation to have a vape-free policy in your workplace and really push that forward, and really promote smoke quitting cessation and smoking cessation programs in the workplace.
Trace.
Actually, I'm all prepared for this. Go ahead, Dino.
Correct me if I'm wrong here, but I think lung cancer was a pretty rare disease until we introduced industrial processes and so on. I think the challenge really is to align with the idea that there would not be any smoking and that there would not be any lung cancer. I mean, we just can't hold off a view that it's acceptable to have lung cancer. We have to have a strategy which works towards that final goal. And I know you can be cynical about strategies, you can be cynical about targets and so on, but I think if you look at the case of New Zealand and other countries where they've cut smoking to the point where you can't get money for smoking research anymore, that we should be working towards that.
You can have the last word, South. Trace, do you want to throw one in?
Yeah, I'm organised now. Sorry, everyone. I was reflecting then. I was reflecting on the 5 lessons that are presented in my presentation. So anticipation, recognition, evaluation, control, and then my personal favourite, ethics, which is the combination of what you know because of those 4 skill sets and executing and get some fire in your belly and getting out there and insisting that we understand hazards before they present risks in our workplace, insisting that we use some science to evaluate them, and then pure energy and investment to control them. Thank you.
Sally North, the Acting WorkSafe Commissioner, the last words are yours.
And interestingly, mine's also about listening to your belly, as Tracey mentioned. What I want to say is that, sometimes you're not sure if something is okay or not. There's a lot of complexity in our work environments, and you might be a little bit worried about something, but it's always been done like that, and no one else is worried. I really encourage you to start a conversation about that, to ask the questions, to find out more, and to contact WorkSafe if we can help you, because we've got a fair bit of information. We've got a contact centre, we have inspectors available. We're happy to hear from you. You don't have to say who you are. If you'd like to give us a hypothetical, we're happy to take that on as well. So feel free to reach out to us. And also if you think there's something that we should know, I'd really like to hear from you. So please start that conversation. Thank you.
Ladies and gentlemen, would you please thank our panel? And thank you very much for joining us today. I hope you found this an informative few hours. Thanks for coming along.